Hi everyone, my name is Ashley Koh. I'm the Program Director of Health Equity Initiatives HEI, an NGO based in Kuala Lumpur, Malaysia that provides integrated and comprehensive specialized mental health services to the refugee community and amongst those torture survivors.
Hi, my name is Hannah and I'm the Clinical Case Manager at Survivors of Torture International in San Diego, California.
Hello everyone, my name is Case Avola and I'm the Social Work Coordinator working with African Center for Treatment and Rehabilitation of Torture Victims in Uganda.
Hello everyone, my name is Javoy and I'm the Social Worker at VAS.
In line with paragraph 6 of the Global Standards on Rehabilitation, we recognize the importance of the availability of free and equal resources for survivors of torture to access services without discrimination or prejudice. Refugees and asylum seekers are vulnerable in terms of both mental and physical health. And during the COVID-19 pandemic and resulting lockdown measures, these ongoing stresses were reportedly amplified by these communities. In this limited protection environment and with these challenges, we call for an even greater need to establish and strengthen intake processes and reinforce partner referral networks as part of a concerted effort to effectively address vulnerabilities of the community and increase accessibility of this population to healthcare services as well. The identification of hard-to-reach communities and vulnerable groups is a concerted strategy in our organization's interventions, particularly the community outreach program through which contact would be established with hard-to-reach refugees and those with special needs or experiencing greater vulnerability. The identification is done through ongoing dialogues with various stakeholders within these communities, community-based organizations, and also community leaders.
Now, specifically here at VAS, we really believe that the intake process is key to client engagement. Now, in my role as the social worker, I really support our intake team. Who is a part of our intake team? We have our outreach coordinator and we have our intake workers. And as needed, we have interpreters as well. So we all work together to make sure that the client experience is going to be one that they feel safe and that they feel comfortable. But most importantly, where confidentiality is something that they understand will be maintained. So, for example, when I really have a conversation with a client and is going through that intake process, I really try to emphasize to them, who am I? What is my role? What services VAS provides? And what information will be shared and who will that be shared with? And using the trauma-informed approach, we understand that clients may sometimes be a little bit hesitant. And so if when we're having conversations, a client may feel, maybe this is not something I want to do just yet, we do respect that. We understand that clients do have that right to self-determination. And so they're able to still get services once they're ready.
And to me, my understanding of the intake process is how we begin our journey with the clients. And to me, if clients do not know that they have survived torture, then they will not understand what services they need. So to me, it begins with information sharing to the clients or to the survivors. And what we do at SCTV is to create a lot of awareness in the community. And we do this through various channels. We do it through community dialogues, through social media platforms, through media house, reaching out to media houses, through radio talk shows, TV talk shows, and also TV commercials. And also in the community, we have developed a community model where we've trained and supported community support networks at the grassroots level to also reach out to survivors of torture, mobilize them, and make referrals to SCTV for services.
So I just want to encourage that, as we're going through a very difficult time in the world, but most importantly, we understand that people need to understand when they have those first interactions that they can feel safe and that they can share, in a really safe environment.
Our intake process at Survivors is quite multifaceted. To keep our clients safe and due to the political nature of our work, our services are not broadly advertised to the public, but rather through strategic and targeted means. We work closely with trusted attorneys, law groups, refugee resettlement agencies, faith-based organizations, and other torture treatment centers throughout the United States and world to help torture survivors in San Diego County become aware of our services.
Of course, we have referrals from, mental health to health professionals and also legal professionals. And so on our website, we have a make a referral link where you can really reach out to us and so that you can refer clients to us. Now, mind you, we are in Canada, so most of our services are geared towards persons already in Canada. But of course, if we are not in a position to support them, we can always refer and try to link them to other services as well.
We also conduct medical outreaches and conduct home visits, prison visits, and hospital visits to clients that cannot reach out to us. And also we have different referral channels through our partner organizations who refer them clients to us to receive our services, and also the clients themselves refer other survivors to us. Some of them walk in because of the information they have had. So and also others are referred by their client, but by their families.
Our referral form is available on our website and has been widely circulated among our network of partners.
In our referral and intake process, we ensure that members from potentially vulnerable groups are identified through screening calls, and referrals from community health workers are highlighted and included as beneficiaries in our services. Additionally, the support to refugees during this time is also taking place through referrals from partner organizations. Their specific vulnerabilities are captured in this formal intake form, and incident reports are generated where experiences of torture or sexual and gender-based violence are detected as well. We also practice the prioritization and triage of vulnerable patients in order to expedite their treatment where necessary, and also provide door-to-door transport as a means of increasing the accessibility of treatment.
Our services are open to both primary and secondary survivors of torture and their families, regardless of race, religion, gender, disability, national origin, sexual orientation, or economic or legal status. All services are provided free of charge and include interpretation, so clients can communicate in the language most comfortable to them.
All referred individuals undergo a standard intake procedure where history taking, informed consent, and psychiatric assessments are conducted. And during this time, we also screen and identify survivors of torture using the definition stated in the Convention Against Torture and other cruel, inhumane, or degrading treatment or punishment. In order to avoid re-traumatization and also to provide a very safe space for our patients, no active probing on torture history is conducted during this process. We also use objective psychological assessment tools to assess the severity of anxiety, depression, and the subjective distress caused by traumatic events, respectively. If the patient also presents other medical or health issues, we make referrals to the appropriate health facilities. We also incorporate a gender-sensitive approach in this process by assigning same-sex service providers where possible, as HEI acknowledges the prevalence of sexual violence in torture. HEI has also set in place a suicide risk prevention protocol that is in place from the start of the intake process. Additionally, we are aware of discrimination experienced by the LGBTQI individuals, and we are sensitized to these vulnerabilities within the organization and the community. Importantly, the patient is actively involved and participates in their treatment from the intake stage. And all potential patients and their caregivers are advised on the available services at HEI and their right to terminate the service before they decide to commence with treatment. Informed consent is also obtained before the service is initiated. The principle of confidentiality is reinforced, allowing patients to have control over the information that they have shared. And this includes seeking written permission from patients before making referrals to partners.
We also have a decentralized model of care and provide services at clients' choice of location, whether that be their home, a public library, a place of worship, the clinician's office, or even via telehealth. With this, we're able to support clients who face transportation barriers or live in remote parts of San Diego County. Additionally, we support clients in detention through psych evals, monthly handwritten letters of hope, and resources regarding pro bono and low bono attorneys. With all of our services, we do not have a cutoff date or a time limit, and clients can receive services until they decide they no longer need survivors' support.
So what then happens in our intake process? This is now where when the clients access us in whichever platform, whether at our center or in the field, we then begin the interaction process. Here, the clients are either interacted with face-to-face and or tele services, because COVID-19 has taught us a lot to also use tele services to reach out to survivors of torture. and we create that rapport with the client so that they can open up to us. We provide still information about the services that are available within the center, the documentation tool that we shall use to take their stories and make assessments on their needs, and also the issue of client consent and confidentiality is then sought. And if that is agreed with the client and the service provider, then the documentation process begins, and then the actual intake then takes place, and then service is delivered to the client. That is the process. Thank you so much.
Thank you very much.
Thank you, and I'm very happy, and VAS is happy that this standard can be implemented, and I hope to, in your organization, you will strive to implement this practice as well. Thank you.